Hey, Dave O'Sullivan here, and in this short video, I want to give you two more really powerful questions in your subjective assessment that's really going to help you gain a clear understanding of what needs to be included in your rehab process, but also where you may want to start with your hands-on treatment. Okay, so as you go through your subjective assessment, you're going to rule out your red flags. You're going to get a good understanding of the mechanism of injury, what's happened, potentially previous injuries. Now, here's the two critical questions you need to be asking in the subjective assessment in order to get that clarity for your rehab, where to start with your hands-on, and also make sure that the patient is going to come back again for the next session. And that is, what do you need to be able to do on a daily basis? Okay, so that's the first question. The second question that you need to ask is what you want to be able to do. Okay, so obviously your needs and our wants are slightly different. The reality is, if somebody needs to do something and they're experiencing high levels of pain, okay, they're probably going to continue to do those things on a daily basis. Okay, so for example, somebody who's caring for their partner, they've got back pain, they're helping with the transfers, getting them up and down off the chair. They're going to need to do that throughout the day, no matter what. Okay, and if the pain is there, they're still going to do that. Okay. Something that we want to do might be something nice, like I want to do the gardening. I want to be able to garden for an hour. Okay, and that's all well and good, but that's not a survival mechanism. That's not a need that they need to be able to do on a daily basis. So what that allows us to do is we can put the wants at the top of the graded exposure. These are nice things that they want to be able to do again, but we must prioritize the needs. Okay, and that's where then that allows us to make a fast start. So the needs that they need to be able to do on a daily basis, we can prioritize our hands-on treatment, we can prioritize our rehab exercises and give the patient strategies to use other parts of the body in conjunction with the lower back, for example. Okay, so for example, with that patient with the transfer, we can get them maybe squashing an orange through the floor with their foot to get the leg muscles to do a bit more work, so the back has to do less work. That's going to maybe decrease the pain experience through processing changes, and then that allows them to be successful throughout the day with their daily tasks that they must be able to do. So then what's going to happen there is the patient's going to feel the difference throughout the day. They're going to feel like they're making momentum, they're successful. That's going to give us a far greater chance of the patient coming back again because they've got trust in you, they've got trust in the process, and obviously the plan as well. Okay, so what you need to be able to do on a daily basis, what do you want to do? The want is nice, but we have to prioritize what they need to be able to do on a daily basis. And we have to optimize our treatment plan and our rehab and the ability to help that patient do these things on a daily basis. If you want more information about this, of how to put all of this together in a structured step-by-step system, just put a yes please below in the comments. Otherwise, send me a message, and more than happy to chat to you and show you how we've helped over 900 therapists in countries all over the world become the go-to physios in their town.